Previous researchers have followed the paradigm of power or dominance, which is dominance theory, and the cultural differences that we have, because of which we use dominance. That's the culture which is giving dominance to the male, and to females they are supposed to be submissive. So initial research normally focuses on those two paradigms. However, they have mostly focused on professional and layman interactions. There are very few researches done on professional to professional communication, because a professional with a layman, that may vary. For example, a doctor who's male is communicating with a female patient, or is communicating with a male patient, and how their speech is changing with the male and with the female. So this is the research that is done in the early researches. If you read the extract 6a, which is given in the next slide, you'd see that the male patient is repeatedly interrupting the female doctor, though the female doctor is more powerful over here in this scenario, that is, she is more knowledgeable. However, male patient is repeatedly interrupting her. It's not because of the power, but it is because of the cultural differences, or it is because of the culture that normally males are allowed to interrupt or to argue. So they are more controlling when it comes to conversations. Some researches were done which were not studying directly the relationship or the conversational differences between a male doctor and layman, that is a professional and a layman, but also the differences of different genders professionals, that is male doctor with a female doctor, and how these two are communicating with their patients. However, they haven't studied that how a male doctor is communicating with a female doctor, but they studied the differences, that is how a male doctor is communicating with a male patient and with a female patient, and how a female doctor is communicating with a male patient and a female patient. So the differences were studied, and that's where the influence of the difference approach comes. um, uh, West conducted the research, and she has the extract has been given in the book, so you can go and read the extracts, that is 6b and 6c. The study is drawn upon some directives. There are two types of directives: aggravated directives and mitigated. So how do you order someone? That is, how would a female ask someone to do something, and how would a male ask someone to do something? It's very obvious, even in our society, that a male would directly ask a question, not looking in at the face level, or not looking, if not looking into this factor that the person is going very direct and it might be not polite. However, female will always go for something which is mitigated, that is, which is a bit mild, asking questions like with can or could or can you do that, or uh, words like these. However, after studying the conversations, it was concluded that the female doctor's style is more effective as compared to the male, because a female doctor takes uh, aggravated directive style, and that is why the patient becomes more um, feel patient becomes more at ease. how a topic transition occurs when a male and a female are communicating, that is in single and mixed sex doctor and patient encounters. Now there are two ways, that is symmetrical and asymmetrical. The symmetrical is when changes are reciprocal, that is the control of the topic is shared and jointly negotiated. That is, they are negotiating in a very normal way, right? And they are not, continuously communicating. It's like not one-sided. In contrast, asymmetrical topic changes are normally termed as unilateral. That is when a speaker topic change occurs without gaining overt consent. That is, directly jumping from one topic to another, and you're not taking the consent. You are not even taking the permission of the person to say something, and you just barge in and in a conversation, and you stop the communication and you start the new topic. This is very common with men. They normally go for asymmetrical topic changes. However, females go for symmetrical, and that is, male doctors favor unilateral topic transitions. However, female doctors, they go for symmetrical, and this shows that males are actually focusing on their power relationships. That is, they exercise power which is given to them by the society. Studies show that men talk more often than women in university faculty meetings or in different situation where a meeting is conducted, or a workplace situation. Normally, it is observed that it does not depend on the status of the person in the workplace, and it is evident that it was found that the male subordinates were still dominating the conversations in different meetings, and they were communicating more as compared to the females, even though females were in higher position than those male subordinates. So this shows that gender overrides status in the workplace, and it shows that men talk more than females. Saving face value. If you look at abstract 60, you'll see that a male is actually saving the face value of a female secretary who has committed a mistake, and he's making her feel at ease by just cracking a joke. And but it is, if you compare this with the other scenarios, other studies, you'll see that females go for more mitigated criticisms as compared to males. Like, males would also criticize and would try to take it as a fun if you have committed a mistake, and would be laughing and using words which would not be very offensive. However, if you compare it with the females conversation doing the same thing, females conversation would be more polite and more saving the face as compared to the males. Framing is actually the kind of interaction that involves the alignment of the speakers with one another. That is, in a conversation, you actually fit yourself in certain role. So it's the role that you are performing as a female or as a male. That is framing. So it's not just identified with, it's the ability of speaking or framing or talking conversation, any conversation. It does not involve the gender, that is, a male is speaking or a female is speaking. It's just like, you consider women as a class and men as a class. That is, that a certain females communicate in a certain way and males communicate in a certain way. So you might have come across this sentence in Urdu or in Pashto, sama khazada, or for example, it's like this very word that we use in phrase that we use in Urdu, औरतों की तरह बोलता है. So in this scenario, in our society, it's like we have set standards for males and set standards for females, and that's how they have to frame themselves, that's how they have to act and speak. So we consider women as a class and we consider men as a class. If you look at this example, it's like Carol is looking into something which is, problem solving kind of frame. However, Ron is going for hierarchical expert frame, where they position themselves as one in the one up position, which is male, and female in the one down position. Now, you might have seen and you might have heard that when you're communicating with a male, do not say that you know it all. Even if you know it, you're not supposed to say that, because they get offended with this thing. So if they don't know something, they are supposed to find their way out, because they are experts in that and they can do that. But if a female is stuck somewhere, so she cannot do that. This is kind of a frame that we have made in our societies. So in the example, Carol creates an impersonalization frame where she is she aids him but presents the information that he needs in an impersonal way, so that he's not seen as lacking in knowledge, because that is something which would hit the face value of Ron, because men get offended with this thing. However, there is a way in which male would be communicating as someone who's very hierarchical, who knows everything and who are experts at everything. That's how they communicate, and that's how they like to communicate. Discursive and social constructionist approach. Social constructionist approach is that our society constructs the reality. So if you look at the conversations of males and females in a workplace, there are certain things that we ignore, and that is, gender is not the only factor which is determining the conversation. There are so many other factors which are determining the conversation of someone. So what we do is we fix our mind on gender, and we are actually generalizing things. So overgeneralization or oversimplification occurs when you are actually looking at the conversations of male and female speech styles, and we forget about what are the rest of the things. However, there are certain ways in which a male and a female communicates, which is mentioned in the next slide. If you look at the previous slides, you'll find that there are certain features associated with the masculine speech styles and a certain with the feminine speech styles. However, there are conversations where you'll find that there is a mixture of stereotypical masculine and feminine discourse styles. That is, somewhere within a conversation, a female will be more submissive. However, in the other, a female will not be submissive. Somewhere a female will be trying to be more informative, that is referential, as compared to being affective, that is more focusing on the emotions. So it is very important to look at the conversation, because the recent conversations are the mixture of a stereotypical masculine and feminine discourse styles. So they overlap or they coexist. As elaborated before about the mixture of the feminine and masculine features of the language, um, the notion of relational practice is the kind of a behavior which is oriented from the face needs of others, that is what the other person wants. So sometimes the face value is, sometimes the face requires to be more focusing on masculine features as compared to the feminine features, and sometimes it focuses more on feminine features. So for example, if a male is communicating with a female employee, and a female I mean females are normally weak in their controlling their emotions, and something might have happened. So when a male is communicating, so he would look at the face value, and he would try to be more polite to her, and maybe use some affective parts of the speech types as well, rather than focusing on only informative one, that is referential. So it it includes mutual empowerment and self-achievement and solidarity in teams, consensus, um, and good working relationships. Let me give you the example of a female who is trying to save the face value, and if she is trying to save the face value, she's a boss and she's trying to communicate with an employee, where she has to show her power, because if she will not show her power, that she is dominating, then it is not the self achievement, or it is not the empowerment that she needs for to work in a workplace. That she's going to adopt some features of the male speech. That is, she might cut the person in the mid while the person is communicating, and try to dominate the speech.